Hi, this is Sarah Reese with Polk County Public Health, and I'm here to provide you with a COVID update. I'm so thankful for Polk County residents for your contributions in helping to lower our numbers. As we've been reviewing the data, whether it is the overall number of total cases or a percent positive, it's exciting to see that the number of cases in our county continues to go down. So thank you for your contributions and your mindfulness to the little things that really do make a big difference. We really appreciate all of you and our group effort. As we move forward, we are undertaking a huge group effort, and that is in the area of vaccines. We're very hopeful and excited to have the COVID vaccine available, and we're even more proud and excited to be working really closely with our healthcare partners and also our pharmacy partners in Polk County and really the whole Northwest region. And we are looking forward to being able to provide you with the COVID vaccine. One of the tricky elements of the vaccine distribution is that there's a lack of supply. And so we are so thankful that you are being attentive and that you are checking in with us and your healthcare partners. But the reality is that we do have a limited supply. And we, as providers of the vaccine, must take direction from the state of Minnesota as part of our provider agreement in terms of who we vaccinate first and how the vaccine distribution is rolled out. What I would like to mention today in this time of ever-changing situations related to the COVID vaccine is that if you are contacted by your healthcare provider that it is your turn to get your vaccine, please take that opportunity. Your healthcare system has systems in place. Some health systems have waiting lists or other ways that they're communicating with you. But when it is your turn, your healthcare provider will make a notification to you that it is time. In addition, Polk County Public Health, working closely with our healthcare and pharmacy partners, are working on finishing up the 1A category. So those would be all people who are healthcare providers. And so that should be finished next week, which we are excited. And when I say finished next week, I mean finished with the first dose of the vaccine. So we're really excited to be finishing that. And our area of focus that was described last week by both the governor and commissioner of health. The new focus groups going forward, of course, are those that are over 65 and those that are in the education and child care worker sector. And so we are working closely with the regional vaccine site as well as our healthcare partners to be able to provide the vaccine as quickly as we get it. First, we have a no waste policy, so we have to be very diligent in our planning, but we also want to get it out as quickly as we get it. So we do not keep vaccine as soon as we get it out. And we have been very diligent in our planning and in our execution to work closely with our partners to get the vaccine out as quickly as we're getting it in. Even though the supply is limited, we are very happy with our ability to get the vaccine out and for people's interest in having the vaccine. We know that the vaccine provides a lot of hope now and into the future, and we are very appreciative of you being aware of the timeliness of the vaccine availability. And while it's not perfect and while we wish we had a large amount of vaccine, the reality is that it's coming in smaller amounts than maybe we had hoped for, but we're grateful for what we have, and we look forward to the future when more vaccine is available so we can get it out quickly. In the meantime, I would ask that people continue with their diligence around those little things. Continue to wear your face covering when you are in public, continue social distancing, good hand washing, and at the end of the day, if you're not feeling well, please stay home, because we don't know if it's COVID or something else. And so all of those little things that we can do that we've been talking about for the past several months are really important during this interim time. So we appreciate your individual contributions and we look forward to serving you.